6, I'm already. How we doing? My name's Nick Sullivan. I got a chance to show you guys a little something that I've been working on for this past couple years. First of all, I'm really excited. So a lot of times I bring a lot of energy when I speak because I really believe in what I've just pretty much have come across. Long story short, this is the very first time I've ever got a chance to talk to people about it. So hopefully it all comes out nice and smooth, but at the end of the day, it's something complex and turning it into something that's user-friendly, easy to understand, and can help people greatly. That's the real work, okay? So we're going to talk about today the vanishing twin. And it may be what you think it is, it may not be what you think it is. But this is a complex thing that I believe has a lot of significance to many physical diseases, many mental, emotional issues, and also I have found, in my belief, I have no scientific proof for it, but in my belief, there's a spiritual significance to why this kind of stuff happens. So this first part, bear with me. I'm just beginning to go off and kind of show you what Western medicine knows about this topic, because this isn't just something that we pull from the ethers, that there isn't any like documentation of it. This is something that is known in Western medicine. Where I come into play is to show you how much of this gets broken down specifically and how it plays a part in many different imbalances of the physical body. So first part, bear with me. It's going to be a little bit of information I'm going to throw at you, and as soon as we get done with it, it's broken up in 3 parts. And I'll have time for asking and answering questions after each part. So here we go. So the vanishing twin, labor of love. What is it? A vanishing twin is a reabsorption of one fetus into multiple pregnancy during the first trimester, often before the 12th week. It's also known as fetal demise or spontaneous fetal reduction. In many cases, the mother may not even be aware of the loss, as the body absorbs the tissue of the vanished twin. It's also relatively common, especially in pregnancies achieved through in vitro fertilization, where multiple pregnancies are more common. It's estimated that it occurs in 20 to 30% of all multiple pregnancies. That's a lot. It's pretty significant. In the early stages of a twin or multiple pregnancy, one fetus may stop developing and be reabsorbed by the mother's body or by the other fetus. This can happen without any noticeable symptoms, or it may be accompanied by a light bleeding or cramping. We know with pregnancy, how many of us have been told that, when women first gets pregnant, if they have a little bit of bleeding at the very beginning of the pregnancy, that's normal, right? We hear about that, so this is what it's talking about right here. But it's usually diagnosed through ultrasound, which may reveal the disappearance of one fetus while the other continues to develop. And in this, you're going to find the reabsorption happens so soon that many times it's not able to be even known that it happened. So the exact cause of VTS are not fully understood, but it's thought to be related to chromosomal abnormalities and implementation issues, which we will get into that. Is the surviving twin affected by the loss? I think so, especially even if you don't know it. Surviving twin typically continues to develop normally, and there's no increased risk for the mother if the vanishing twin occurs in the first trimester. However, some studies suggest potential risks like early delivery or low birth weight in the surviving twin if the demise occurs later in pregnancy, though it's not always the case. Babies who survive the loss of a twin, either before or shortly after birth, can experience a range of emotional effects, including grief, loneliness, and a sense of being different from others. They may also struggle with attachment issues and survivor's guilt. That's usually for people that knew that they were a twin, but some of the stuff we're diving in here is when you wouldn't even know it. So, surviving twins can experience a deep sense of loss and loneliness. This is a big one. Even if they were very young when their twin passed away, they may feel a void or longing for a connection that they never fully experience. Think about a soulmate. Put that up, save it for later. Studies suggest that surviving twins may have an increased risk of developing certain psychiatric disorders such as anxiety, depression, or other mental health issues. So, twins, there's definitely a few variances to what this stuff can produce. So once again, this is all what Western medicine's been able to document, so this is all factual, okay? So the type of twins that are out there. So first of all, they can be twins, monozygotic or dizygotic, which is basically fraternal twins. They're not identical. And they can have separate placentas, 2 amniotic sacs. They can be monozygotic, which this is one that has 1 placenta and 2 amniotic sacs. Okay? Or monozygotic, this is like a identical twin. So over here on this side where they have they share a placenta and an amniotic sac. So these variances contribute to the variousness of it. So first, let's talk about the splitting of the egg. Identical twins. It's so much fun finding these photos and looking at all these good-looking kids that are on here, and just how it's amazing that 2 people can come out looking so much like each other. I just find it so cool. So, identical twins. They develop from a single fertilized egg that splits into 2, resulting in nearly identical DNA. Identical twins are always the same sex, and they share the same blood type. They usually look very much alike with similar facial features, body structures, and even though they are identical, fingerprints and bite patterns are oftentimes different with these twins. They're unique to them. Some other physical differences, they may differ in handiness, their hair growth patterns, or the presence of certain features like dimples or birthmarks that appear on the opposite sides of their bodies. Although they share a high degree of genetic similarity, personality and behavioral differences can develop due to emotional factors, experiences, and lifestyle choices. I know a few sets of identical twins that are very different than each other, and some that are exactly like each other, and watch out for them. They're a lot of fun and pretty crazy. Identical twins often develop a strong emotional connection, with some research suggesting they may even develop a unique language or experience some sort of telepathic incidents. And I think that's what Western medicine is trying to call being empathic and being intuitive. I think that's what they're trying to talk about. Now, fertilization of more than one egg. Fraternal twins, ones that basically 2 eggs are fertilized by 2 sperm, same mom, same dad, but definitely look a little bit different. They're also known as dizygotic twins, developing from 2 separate eggs fertilized by 2 different sperm. They usually have genetic similarities, but also they can have different physical traits, such as different eye color, hair color, body type, and can also exhibit distinct personality traits and interests. Fraternal twins usually can have different physical characteristics, like eye and hair color. Each twin inherits a unique set of genes from their parents, leading to these variations in physical traits, and they're not always easily distinguishable. While they can have distinct physical features, some fraternal twins may still resemble each other closely, especially if they share similar features inherited from their parents. But genetically, they're about the same as what most siblings are, just not identical. They have different personalities, interests, and temperaments. We talked about that a little bit. And it's not uncommon for fraternal twins to have contrasting personalities or behaviors, with one twin being more outgoing and the other one like being a little bit more introverted. I have a few friends that are that way, where one's always kind of like the life of the party and he's always kind of like out there, and the other one kind of like reels him in and tells him to calm down and think about what he's doing. But even though they're the same, they're very different in that regard. Some other considerations with the placentas: fraternal twins typically develop with their own separate placenta. And this is really important to understand because they are separate. They share about 50% of their genes, similar to any other siblings. Now, a mirror twin in rare cases are fraternal twins that can be mirror twins, with one being a mirror image of the other one. So basically, like if one had a mole right here below their right eye, the other one would have it below on their left eye. And so this is also a phenomenon that happens with twins. Once again, I'm just sharing with you guys what Western medicine knows about this stuff. Presence of gene absorption in the womb. Chimerism. It's a condition where an organism contains cells with 2 or more genetically distinct sets of DNA. This can occur naturally, like through the fusion of 2 embryos, or through a medical intervention such as stem cell or organ transplants. Essentially, it's like having 2 twins within one body. People with chimerism can sometimes have different eyes, different colored eyes, heterochromia, but it's not a guaranteed symptom. Chimerism occurs when an individual has 2 more sets of DNA, often due to the fusion of 2 embryos or the absorption of a twin. While some chimeras exhibit visible signs like different colored eyes, skin patches, or ambiguous genitalia, many cases go unnoticed. Ambiguous genitalia, meaning they probably got both in one way or another. It's a thing. Look up hermaphrodite. Autoimmune diseases and the thymus chakra. This is where I really started to get into what I was finding, because when I first started getting into this work, I noticed that there was something on this chart. It was just some basic dowsing chart that I found on the internet. And what it kept pointing to, when I would first ask what's wrong with this person, people would reach out to me looking for healing energy because they have some sort of weird disease, right? And so I would look, and every time it kept getting pulled to the thymus chakra. How many of you ever heard of the thymus chakra before? Right? But we've all heard of the 7 major chakras, right? This one never gets talked about, and it's super important because it's also considered the seat of the soul, or a gateway to higher realms. But the thymus chakra is also 100% connected to your immune system. It's connected to everything: circulatory system, nervous system, lymphatic system, all of it. So we'll talk more about the thymus, but let's talk about autoimmune diseases. Because what I was finding on these kids, and finding on these people, especially kids, they would have some sort of attachment to this thymus chakra, and they would have a whole host of some sort of autoimmune issues. Is where I keep finding this stuff. So like lupus. Lupus is kind of a common one. It's also known as systematic lupus. It's a chronic autoimmune disease where the immune system mistakenly attacks healthy tissues and organs. This leads to inflammation. Is it starting to paint a picture yet of why the body would choose to attack itself? Because maybe our perception is that we're only just one, but there might be another set of DNA that's there that it's attacking because it's foreign. Put that up, save it for later. Joints, skin, kidneys, heart, lungs, and brain. Lupus can cause a wide range of symptoms which vary from person to person. Some common signs is like fever, fatigue, chest pains, achy joints. The butterfly rash you see a lot of people get up here is kind of a normal one. Most of the people that I know that have lupus usually have like a lot of like joint pains, like their wrists, their elbows, their shoulders, their hips, their knees seem to have a little bit of that. They get rashes that kind of pop up and come and go. I would say that's probably the main cause of it. A little bit of weight loss sometimes, but definitely swollen joints is a big part of lupus. You can see joint pain and swelling, fatigue, sensitivity to sunlight. Some people that have lupus have a hard time being in like direct sunlight. Mouth sores, kidney issues, hair loss, chest pain, and even all the way down to seizures, which once again kind of makes me think about maybe the presence of something foreign in the body that we were born with. Let's talk about Hashimoto's. Hashimoto's thyroiditis. It's a chronic autoimmune disease where the immune system mistakenly attacks the thyroid gland. Why would it attack the thyroid gland if it was perfectly healthy unless there was something there foreign that the body was attacking? Causing inflammation potentially leading to an underactive thyroid, hypothyroidism. This can result in a range of symptoms including fatigue, weight gain, and cognitive difficulties. So the autoimmune nature, the body's immune system, which normally fights off infections, mistakenly identifies the thyroid gland as a foreign invader and attacks it. The thyroid damage, the attack leads to inflammation of the thyroid gland, which can impair its ability to produce thyroid hormones. As a result of the thyroid damage, the gland may not produce enough thyroid hormones, leading to hypothyroidism. Common symptoms include fatigue, weight gain, dry skin, hair loss, constipation, muscle aches, and sensitivity to cold. And a goiter. Anybody ever seen a goiter? Big old things that point up. Has a lot to do with it too. In some cases, the inflammation can cause the thyroid gland to enlarge, forming a goiter. Fibromyalgia, chronic condition that causes widespread musculoskeletal pain, fatigue, and other symptoms. It's often described as pain all over the body, but can also include fatigue, sleep disturbances, and cognitive difficulties. While there's no cure, treatments can help manage these symptoms. And you can see, anybody here ever dealt with fibromyalgia before? I remember my mom would have spouts of this stuff, and it always seemed like it was brought on by stress. Every time my mom would have really stressful bouts, after my mom got through like a divorce, there was a lot of times where she would have like panic attacks and she would have issues with fibromyalgia. And I remember like trying to give her massages and stuff. So I do believe that stress and anxiety and some of that stuff plays a big part in this. So let's get back to that thymus chakra we were talking about, okay? Thymus chakra, right here. Here's your heart, here's your throat, thymus chakra, seat of the soul, sits right here. It's also known as the higher heart chakra, which some people I've heard talk about. It's an energy center located in the upper chest between the heart and throat chakras. It's associated with compassion, empathy, and unconditional love. It's also believed to be a bridge between the physical and spiritual realms. It's also linked to the thymus gland, which plays a crucial role in the immune system. What are the benefits of a balanced thymus chakra? It's believed that a balanced thymus chakra can positively influence the immune system. So if it's compromised there, then it has issues, right? So if it's balanced and healthy, you have a strong immune system. If you have an immune system that's attacking itself, something there is imbalanced. Aiding in self-healing and regeneration. It can promote feelings of peace, serenity, and balanced emotions, leading to more restful sleep and reduced irritability. A balanced thymus chakra can facilitate deeper self-awareness, spiritual understanding, and the ability to express selfless love, not just for other people, but very much for yourself. It can foster a stronger connection with others and the ability to experience and express love and compassion more readily, and it helps align emotions with the words we choose to express them. People that are usually really guarded and stuck off from people and maybe don't express themselves really a lot usually have something going on here. And it doesn't always have to be absorbed twin. It can definitely be an emotional thing too. So it's definitely something to just know that this part really controls a lot of what's going on with us. So how can we balance it? Regular meditation can help develop awareness of the energy here. Connecting with nature, this is huge. This is one of the reasons why I love coming here, because we're all the way out in this beautiful place that, you know, I'm not from, but just being out in nature and being in a new environment is so helpful for you guys. So if you guys don't know what to do, man, go spend some time in the woods. Go spend some time at the beach. Go down to that lake. Go take a walk in that park. It'll all help. Spending time with nature can help harmonize and balance the chakra's energy. Certain crystals like rose quartz and amethyst are believed to be beneficial for the thymus chakra. And sound therapy. Listen, I know we had some people here doing the sound bath stuff. I really love it because that stuff's really helpful too. Working with crystal singing bowls tuned to the F note associated with the higher heart can also be helpful. So here's where we start getting into the good stuff. Cellular and genetic absorption. And this part is almost done, so I'll have time for you guys to ask questions here in just a minute, okay? Germ cells. This is very, very important part right here. Germ cells can differentiate into various cell types, including bone and tooth-forming cells as seen in teratomas. Teratomas are tumors that contain a mix of different tissues, sometimes including hair, bone, and teeth. Specifically, neurocrest cells, which is a type of stem cell, contributes to the formation of craniofacial bones and teeth. How many of you guys have ever heard of people having tumors that had like teeth and hair in it, right? Yeah, it's a thing. It's a thing. And so some people would think right away that, okay, if there was like a loss of child, you somehow absorb part of it. You absorb cells that turn into these things, that turn into hair, that turn into eyes, that turn into teeth, that turn into the circulatory system, that turn into the lungs. You absorb these cells, and it's not always from there being a loss in the womb. In fact, these cells can travel outside of the placenta and easily get absorbed by the mom, and she can have issues with it, or the next child born in that womb can take it and have issues with it. We were just talking about teratomas. They can basically turn into any cell in the body. When the teratoma forms, these germ cells can differentiate into the various cell types, including bone and tooth forming stuff. The neurocrest is really interesting because it plays a crucial role in development of the facial and teeth. But this also means like spine too. So anything along the spine with your nervous system, these neurocrest cells can affect. So a couple pictures of the teratomas. I know they're kind of gnarly looking, but we talk a little bit about how these can develop in different parts of the body. One of the most common places you can find them is around the ovaries with women. You always hear about women that get ovary, like tumors or cysts that are on the ovaries. Many times it's these. Many times it's this. Sometimes you ever heard of people being born with a tail? You ever heard that? That's it. That's another place that they get lodged in too. One of the other times they also get stored is in the head. Head tumors. Head tumors. People being born with head tumors or ones develop when they're at a young age have a lot to do with this. Now, while most teratomas are benign, some can be cancerous, and their behavior varies depending on their location and their maturity, meaning the young ones can be cancerous. The ones that have been around for a little bit, not so much. But the ones that have been around, let's say a generation or two, and have finally manifested can be absolutely cancerous. So they can be comprised from any tissues from the three germ layers, the ectoderm, the mesoderm, and the endoderm. That means they can contain a wide variety of, skin, hair, teeth, and all that stuff. Let's see, I think we talked about this. Testicular teratomas are a type of germ cell tumor that can occur in the testicles in men. That's also a thing too. Metastatial teratomas are found in the space between the lungs. And sacrococcygeal, whatever that's, I'm not sure how to say that. Sacrococcygeal teratomas develop in the tailbone. That's what we talk about, the tail, right? So they're classified as mature or immature based on the degree of tissue differentiation. Mature teratomas contain well-differentiated tissues, while immature teratomas contain more embryonic or fetal-like tissue. Treatment for teratomas depends on their type, maturity, and location. Surgical removal is the most common treatment for both benign and malignant tumors or teratomas. Chemotherapy may also be used to treat malignant teratomas, especially those that are immature or have spread. Once again, this is where we hear about when people have cancers or tumors, they can get them cut out of the body, but then they kind of manifest in another spot in the body somewhere else. Maybe it's because there's a root to it that's in the energy field. Talk about that later. So this kind of gives you a little bit more understanding of what neurocrest cells actually are, the things that come from the spine that create your nervous system, your circulatory system that travel into the body, create the heart, create the lungs, create the stomach, the pancreas, the brain, everything. They're the ones that stem off and create everything. So what can be in these teratomas is tissue that create all of those. This is really, really important to understand because we're getting to the finer stuff of what it means to have absorbed twin. What we're actually talking about is absorbed neurocrest cells. So here's a little picture of some of the systems we just talked about. But this is the end of part one. This is where I just got done with all the factual stuff I get to talk to you guys about. Anybody have any questions yet? Cool. Yeah, it's coming up. Yep, because there's three parts to it: physical, mental, and spiritual. We just started talking about the physical part. But now we're gonna have a little bit more fun. So, those of you guys who don't know, I've been doing a case study for the past couple of years, got over 100 people. I've done this on hundreds of people, but actually documented this on over 100 people recently, all over the world, all walks of life, male, female, transgender, child, adult, all walks of life. 100 different people, 100 different cases in this, okay? And so they all had some sort of autoimmune disease, cancer, dysphoria, or some sort of unknown medical condition. Anytime I hear somebody say, I went to the doctor and they don't know what's going on with me, they can run tests, but they don't know, this is what I really get interested in because I think we can help. Being Dowsers, we're really good at picking up on what people can't see. This is no different. I was able to break down each reading to the presence of certain neurocrest cells that develop the various systems of the body. The most prominent in the study found cells associated with the skeletal, circulatory, respiratory, lymphatic, and reproductive systems. In many cases, these were linked to a trace of an absorbed twin either from the womb or in the family lineage inherited. This also includes the presence of cells left over from abortions, miscarriages, and stillborns. So, in all this information, I was able to break it down into 4 main spots. Okay, so what these are, the first one, absorbed twin from the womb, meaning the fetus in the womb absorbed the other one. First scenario. Second one, absorbed twin in the family lineage. Let's say grandma had a fraternal male twin that died in the womb that she absorbed. She gave birth to her daughter who was perfectly fine and healthy, and then her granddaughter was born with cancer. This is something that's taken down in the family lineage, and this accounts for more than 70% of the cases that I've did. So just think about that. And if you were born more than 60 years ago and didn't have access to advanced medical equipment, you really have no idea because we wouldn't know. And most of this absorption, like I say, it happens in my experience in the first 9 weeks. So it's something that even at that time, it's super hard to detect, right? So third would be absorbed in the womb from the miscarriage and abortion. This is when the mother absorbs whatever leftover tissue, which I'll tell you, it's not a lot compared to this, okay? But it does happen when the mom absorbs it. Then the last part would be absorption in the womb from a miscarriage or abortion from the fetus. So what that means is there was a miscarriage beforehand, new child came into the womb a year or so later, and it now has part of that, and it takes it with it. Back to the thymus chakra, that's where you're going to find it more than likely. So how do I find this stuff out? Well, I created a little bit of a chart that kind of helps me map this, kind of helps me get that direction. And as you can see at the very top, you can email me, and I will gladly send you this chart for free, no problem. All my charts are always free. But basically, the process and the way it goes is I would first have my pendulum, and I would swing, and I'm looking at whoever I'm looking at that's on this case study, and I would ask, do we have the presence? I would just call them astral fragments or the presence of an absorbed twin in any way. You can just say however you want. And so what it would do is I would get a yes, and then it would swing to one of these. Let's say fraternal twin female, right? And then I'd say, okay, how many weeks along was this absorption? When did this happen? And most of my cases were right here, 9 to 12 weeks. I think 1 or 2 of them were up here, but the majority of these cases were right here at the very beginning of pregnancy. From there, I would ask, were there any systems absorbed, any NeuroQuest cell systems absorbed in this? And my yes would be around this line right here, but most of the stuff that I found, nervous system, skeletal system, reproductive system, and the respiratory system. Those were the most common ones that I found here. I did find a couple other ones, but those are the most common. And then last but not least, where did it come from? Over here on the side, you got great-grandmother on the mom's family, which this doesn't come from dad's family. It can't be handed down from dad's family. It comes from mom's family. Great-grandmother's mom, grandmother's mom's family, or if it's in the family lineage, or trauma from the womb. So the difference with here, I'll try and describe it. When we have this, we look back, great-grandma, and this is from your perspective or from that person's perspective. If it's in the family lineage, this means that it's come down many generations. Anybody ever heard of genetic family diseases and stuff? Think about that. Trauma from the womb, meaning they got this in the womb. They got this in the womb. So that's where I kind of map out how I got this path, where I get this information from, which leads me to how to discover all this stuff. So, an absorbed twin from the womb. This accounted, so this is out of all the cases, I'm telling you what I found. So it absorbed accounted for 10% of the volunteer examinations producing the following connections. The absorbed nervous system gave Crohn's disease, fistulas, and sacroiliitis spine. An absorbed respiratory system, Hashimoto's, early ovarian failure, intestinal and urinary cystis. Absorbed skeletal system, head tumors, and lymphatic cancer. Fraternal, did someone say something? No? Oh, bless you. Fraternal twin absorption in the womb accounted for 5% of the volunteers, so this is like really rare when it comes to this stuff. This doesn't happen very often. For 5% of the volunteers examined, producing the following connections: the absorbed reproductive system, ulcerative colitis, and kidney stones. Absorbed nervous system, aneurysm. So let's say miscarriage and abortion absorbed by the mom. Once again, it is a thing, but it's not very common. It's not very common. It happened in less than 3% of the volunteers examined, the following connections. Mast cell activation syndrome is what I found with this. Now, miscarriage or abortion absorbed by the fetus, more common, but still rare, but more common. They're absorbed by the fetus, according for 11% of the volunteers. Absorbed nervous system, this is huge, guys, because it produces seizures, thyroid tumors, and supraventricular tachycardia, or how many people are born with an enlarged heart. The absorbed reproductive system, paranoid schizophrenic delusions, and something that might rub people the wrong way, transgenderism. Think about it. If you felt like a Skittle in an M&M bag your whole life, maybe there's a reason. And I don't say this to make people think there's something wrong with you that needs to be cured, that needs to be fixed, but if anything, this puts a little bit more sustenance behind why you feel the way you feel, because you carry the DNA of another sex inside of you. That is why you feel the way you feel. Here is some actual proof of why you feel this way. These people that I know that were transgender, I said, hey, look, I'm doing this stuff. I would love to put you on my case study. And I had about 3 people, and every single one of them had this in common. But here's the good question. I asked them, do you think you're in their body, or do you think they're in yours? Cells and tissues absorbed by fetuses, with the mother likely also absorb them in the womb, can be passed down and seem to skip generations by being dormant or actively creating imbalances in the body. I broke this down to 2 categories, including identical and fraternal twin inherited. Identical twin inherited, meaning you're absorbing information from an identical twin. Counts for 12% of the volunteers examined. This would be like if grandma had an identical twin female that died in the womb that she absorbed and passed it down, less than 12%. And what we see with the respiratory system absorbed, ankylosing spondylitis and lupus, absorbed nervous system, fibromyalgia, IBS, gallbladder issues like such as removal, hysterectomy of the ovaries, Hashimoto's, ovarian cyst, appendix removed, and allergies. Severe allergies are usually linked to this kind of stuff too. Now here's the one that really kind of blew me away, because here I have over 100 cases of people from all over the world with all these different issues and cancers and all sorts of different diseases. And 70% of these people all had the exact same thing in common. 70% out of over 100 cases, that's extremely significant. So what that means is this accounts for grandma having a fraternal male twin that was absorbed in the womb. And in this, she held on to, had a daughter that was healthy, for the most part was healthy, and then on the next one, the next generation, they would have cancer. Stuff like leukemia was a big one, blood cancers, bone marrow cancers, this is where a lot of this stuff comes from. Absorbed reproductive system created nocturnal epilepsy, transgenderism, miscarriages, AVM and reproductive system, paranoid schizophrenic, and delusions. Here's the thing, if you constantly feel like there's more to you than what's being told, these people, I know that, it's great we live in a society that tells people you can identify as whatever you want, but what I really help people understand with this, for one, you're right, and 2, this is the reason why you probably feel that way. It's because there's something going on underneath the surface. Us being Dowsers, we can detect things that we can't be seen. An absorbed circulatory system, lupus, Sjogren's, and hysterectomy. An absorbed endocrine system, mast cell activation syndrome, and psoriasis. Absorbed nervous system, chronic fatigue, eczema, asthma, Hashimoto's, and migraines. That migraine, by the way, back to that thymus chakra, that's where you're going to have that attachment, and that's what creates a lot of those migraines. Yes?
When you mentioned the transgender one on the earlier one, and you said, are they in your body or are you in their body? is it similar for like schizophrenia type of stuff where it's like they are present in your body?
You know, it's a really good question, and I really appreciate that because it talks about something that's not really in this talk too much, and that people that are schizophrenic, the difference between a medium and a schizophrenic is someone that's trained. That's the difference. So someone that's schizophrenic, they are the medium between the physical and the spiritual realms. In the Western world, we give them medication and lock them up and say, we don't know what to do with you. If they lived in the jungle in a more indigenous community, the village would take care of them. Their sole responsibility was to be connected to spirit, be able to interpret things to the people so that way good stuff can happen to them and they can have some sort of like a vision of the future, right? Whereas over here, we don't know what that means, and usually trauma attaches to this stuff, and it can just really spiral out of control when you don't have anybody to talk to that can help you with this kind of stuff, right? So the other thing what this means is when you have an absorbed twin, you are automatically sensitive to spirit. You're automatically sensitive to spirit. When I first got into this stuff, and I see these kids that have all these attachments to the thymus, all of them were dealing with stuff with the paranormal. They're all sensitive to spirit, but it's almost kind of like when we get into the last part of this, it's almost like happening for a reason. You know, you ever even heard of people that are like empaths? I've talked about this before. You grow up in a family that's like, that stuff's not good. You don't do any of that stuff. All that woo-woo stuff is bad. And you're a child, and you grow up around emotionally unstable adults that fight, that do bad things, or just whatever it is, just have a really chaotic environment at home. Those kids will walk into a room, and they can read that room and tell whether or not they should even speak on anything. That trauma creates empaths. Empaths are the ones that are here to bring balance. That's what it comes down to. Absorbed skeletal systems. This is like the biggest part. This creates the most issues as an absorbed skeletal system. Endometriosis, POTS, gastro issues, epilepsy, IBS, twisted bowel syndrome, gallstones, psoriasis, psoriatic arthritis, celiac disease, bone marrow cancer, traveling cancer, leukemia. All contributed to a fraternal male twin that was attached to grandma that was handed down, and what was attached was remains of a skeletal system. We can conclude that the following conditions are linked to cells and tissues being absorbed either from the womb or inherited in the family from different systems in the body being absorbed. The nervous system. I saw this stuff pop out, and this is the same case. In the 70% of cases, this is what I found, people that absorb the nervous system. Parathyroid tumors, AVM, Crohn's disease, fistulas, sacroiliitis, fibromyalgia, IBS, gallbladder removed, supraventricular tachycardia, seizures, Hashimoto's, chronic fatigue, ovarian cyst, appendix removal, and tons of food allergies. Absorbed reproductive system, epilepsy, transgenderism, autoimmune disorders, food allergies, digestive issues, ulcerative colitis, kidney stones, and paranoid schizophrenics. Respiratory system, ankylosing spondylitis, lupus, erythematosus, Hashimoto's, and intestinal cystis. So skeletal system, we've been talking about this stuff. There's a lot of things that really come with the skeletal system. But as you can see, using that chart and kind of mapping out which systems are being absorbed, it starts connecting it to which diseases manifest in the physical body. So this is the end of part 2. Questions? I'm throwing a lot at you, and I'm really glad you guys are staying with me right now because I got more. So getting to what you asked about. Emotional and psychological effects of losing a twin. You know, I want you to think of something. I know so many people in these spiritual community. And even people that aren't just trying to get into it, they want to know about a soulmate. They are longing to find a soulmate, some sort of twin flame or a soulmate. What if they already experienced that soulmate and then had it taken from them very, very early on, leaving them with a sense of looking for that, longing for that? I believe when kids are in the womb, that if we have these abilities right now, that we can do astral projection, we can do remote viewing, we can be empathic, and we can be intuitive. We're working with things that are beyond the physical body. When these kids are in the womb, their eyes won't be developed all the way, their mouth isn't developed all the way, their skin might even be developed all the way, but there's pressure. That pressure in there shows that they're not alone. And not only that, I think they're aware of each other that are in there. That's why you see a lot of them sometimes will like hold hands or like do stuff in the womb where they kind of get next to each other. But losing this stuff, think about it. If you lost a twin and you had this little body that wasn't fully developed, you didn't have all of this trauma to just go places. So what happens is it gets absorbed in the cells. It gets absorbed in the physical body. I think we can all agree that people hold on to stress in the physical body, right? We can hold on to trauma too in the physical body, okay? This is no different. So what happens, we hold this trauma in the physical body and then it gets absorbed, and now we have these overwhelming feelings like fear of abandonment, fear of being alone, fear of being forgotten or left behind. Or sometimes when people realize that they were a twin, there's almost like a survivor's remorse that comes with it. They feel bad because they lived and the other one died. So there's some psychological effects that go into this stuff as well. You may not know your pain originates from someone you never met. Vanishing twin syndrome is often undetected, but the emotional longing remains, manifesting as restlessness, loneliness, and a constant search for something missing. Vanishing twin experiences may hold key to understanding a strange sense of loneliness or a deep, persistent guilt for simply existing. Anybody know anybody that have a guilty personality? Despite being successful or surrounded by love, have you ever felt emotions you couldn't quite explain? These may not just be psychological, they may be biological, ancestral, and systemic. One such phenomenon that sheds light on this hidden grief is the vanishing twin syndrome. Increasingly recognized in systematic and family constellation therapy, this syndrome refers to the experience where one of the twins or multiple embryos in the womb disappear during early pregnancy, often before the mother even knows she's carrying more than one child. That is the big thing here, because people don't even know that this runs in their family because it happens so soon that it would be undetectable sometimes. But being Dowsers, that's what we're good at, detecting that stuff. So the emotional burdens that kind of come from it, they can internalize some subconscious beliefs such as, I must earn my right to be here, I have to be perfect. A lot of people get this perfectionist attitude. I can't fully enjoy life when someone else didn't get the chance. These beliefs can manifest as overachievement or perfectionism, deep-seated guilt and unworthiness, difficulty in forming secure attachments, and repetitive burnout or self-sabotaging behaviors. So getting back to that trauma imprint on the body, it can lead to somatic holding patterns where the body holds on to tension and distress. This can be due to the body's natural fight or flight response getting stuck, leaving a lasting imprint on the nervous system and potentially affecting organs, tissues, and muscles. Physical symptoms like chronic pain, headaches, muscle tension, and digestive issues can emerge years after the traumatic event. Unprocessed trauma can be stored in the body, and the brain may disconnect from the affected areas, blocking the experience. This stuff I don't think happens very much when you have two twins that have separate amniotic sacs, but ones that share it, I think absolutely. And if you think of it, if one twin dies and let's say the blood coagulates and it shares with the other twin, this is what's going to damage the central nervous system. What's not in this talk is also cerebral palsy is a big part of this. Down syndrome is also a big part of this. Down syndrome people are known to have an extra chromosome, right? Wonder where they got that. Unprocessed trauma can be stored in the body, and the brain may disconnect from the actual affected areas to block the experience, or what some psychological things would be called disassociation. When there's trauma and we disassociate from it, come off as that. Now here's the fun part. Here's where I'm just kind of doing what I do and asking the questions that I ask. I've shown you guys a little bit of the Western science and health understanding of the actual stuff of the twin. I've showed you my results leading to the different connections that I got. But this one right here is going to require a little bit of an open mind. Spirituality in the absorbed twin. So, our women, men too, but our women gain imbalances over time. Women, y'all take a lot. And y'all are very, very resilient. You have really been through a lot in these generations. Hold on to it. The physical body of the mother can often become unbalanced over time due to trauma and emotional issues. Trauma can be handed down generations as well as non-beneficial tissues that are present from abortions, miscarriage, stillborns, and absorbed twins. This creates what would be called hereditary family diseases or genetic disorders. Here comes the one to bring the balance. There's a few ways we can do this. I mentioned earlier about that kid that grew up in a violent home, that learned how to be empathic and read a room. Your ability to awaken now and be that person that brings balance back to your family lineage is a potential you have right now. If you don't want to walk that path, it's cool. It'll go down to the next generation and maybe someone will carry the torch then. But there is something going on here. There is someone that's within your soul family, and I hear a lot of people talk about soul parents and guardian angels and spirit guides. If you don't put a name on it, it doesn't matter. All you need to know is that there's someone above that's connected to you that loves you very much. and they say, hey, you know what? Look at all those imbalances going down there happening in my little family circle. I'm going to go down there and incarnate into that body and try and take all of that imbalance with me and go to the grave. Bring balance back to your family lineage by going down, dying, taking it all with you to the grave. Wasn't there a story about a fella that came down from heaven, died from our sins, just to ascend back to the Father? This is another way that we can do this. If we come down from heaven, die for all a man's sins, go to the grave, and ascend back up perfectly. There is something going on here, and what it all is achieving is balance. And it doesn't really matter who the messenger is. Did you get the message? That's just one parable. Whether or not people believe in Jesus doesn't really matter. But the path and the understanding of how to get back to source and get back to balance, I think is important here, because whatever's happening, there's some really brave souls that are coming in and deciding to take this head on and trying to take it to the grave with them to create balance. Yes, sir.
So basically, all the families have somebody that is crazy or slow or whatever, right?
Some got 2 or 3.
Most families have somebody like that.
Sure. You know, and here's the thing. I think what you're getting to is you have this capability, right? Someone in the family that ends up becoming like schizophrenic, or someone that's kind of along this way, right? They can be that natural medium between the two worlds. And oftentimes we're sent down here and kind of on a lily pad, and we're not surrounded by people that are that way. We're usually alone, but somehow, some way, there's either someone in the family or like a friend of the family that is kind of into that stuff that we get into. So we have the potential. We could do absolutely nothing with this, right? We can just say, I'm bothered by this stuff. I don't want to experience it. Give me all the pills that you can so I don't have to experience this stuff anymore, right? That is a choice. But it's just going to get handed down to the next generation, and it's going to give them an opportunity. So if trauma can be handed down, we are in the perfect position to send healing back up. Yesterday and tomorrow can only be experienced right now. So what that tells me right now, I'm connected to both, because we can only experience it in this moment. So what can we do at this moment? Be powerful. And their potential to help heal is really good. So what I like to say is someone from our soul family comes down to take care of all imbalances with them to the grave and bring balance back to your family lineage again. Now, here's where we'll get to a little bit more of the meat and potatoes. Do we have any other questions on it? Because we're going to change it up a little bit. Cool. How do we do it then? We've talked about it enough. How do we do it? So energetic balance from the outside. So right there, the luminary pendulum, I brought this down. This is pretty much the latest and greatest of my creations. What I've found is a lot of the spiritual work, if you guys are watching the stuff I do, usually has to deal with like earthbound spirits and non-human spirits. I do a lot of work with that stuff, right? So this can take care of anything that comes your way, but this has a real unique ability to help with what we're going to do here. And the energetic balance from the outside. Using this pendulum, you can use infrared frequency and orange or yellow frequency for best results. This is where we challenge the belief that any pendulum will work for anything. I kind of have a variance of a difference of opinion on that. I think any pendulum can work for just basic asking questions, for basic clearing of stuff, but when you actually want to have leverage and start changing stuff on a cellular level with stuff specifically, these are the things that I have found that give me the best response. But do me a favor, don't believe a word I say. Try it yourself and see what you get. This is what I found. It can be done easily at a distance or in person. So at this point, the balance from the outside, I work over like a picture of a person. Someone will reach out to me and I'll have like their picture on my phone, and I'll literally just hold it over my phone, ask to connect to their higher self, and they'll start doing this work. This is how I do it from the outside in, which is important because going back to tumors being cut out and manifesting in other areas, you're going to need to do this because there's a seed in the energy field still. So some of the balancing protocols, I'll run through it real quick, but these, I'll definitely send them to you guys if any of you guys want these protocols, but I try to put it down exactly the way that I would use it. Once again, taking something really complex and trying to put it in a user-friendly format. Take everything I say on here with a grain of salt, and how you can incorporate it into what you're already doing is the best way to do this. This is just the way it works for me. So first we was asked to connect to the higher self of all absorbed twins or astral fragments in the family lineage of the person as being balanced. Remove all pain. Cure all astral illusions in the absorbed twin, astral fragments present in the family lineage. And the way that I do this, if you guys have ever seen me work with pendulum stuff over here, so you can see it. you guys ever seen the way I do this, you know, for me, I incorporate the breath. The breath is a huge part in doing actual healing work because what we're doing is sending life force. If it's the first thing we take coming into this body and the last thing we take when we leave it, that tells me that that's sustaining our life and our presence that connects us to this world. Okay? So having a physical body, you got yourself a strong electromagnetic field and you can manipulate other stuff with it too. So when we combine the breath, what we're doing is we're sending life force with it, with that part of us that connects to source, or what some people would call Christ. It's just source energy, whatever you want to call it. So the way I incorporate the breath, if I just said, for instance, I asked to neutralize all stagnant emotional energy in this room, you'll see it'll spin. And how many of you guys have done this stuff where it'll spin for like 2 or 3 minutes? Okay, I don't got patience for that. I speed up the process. So what I do is I ask to neutralize all stagnant mental, emotional, physical, spiritual energy in this room from all timelines. Much quicker. Because sometimes if we're not breathing, if your pendulum is spinning, I'm like, well, I sat there for like 5 minutes and it just spun. Breathe. Breathe with it. Breathe. It'll process it so much faster when you do this. And working with wood, you don't have to use wood to do the breath. It'll work with brass pendulums, silver pendulums, crystal pendulums. It works with all of them. But I always find the best response with wood. Just for some reason, I find it has a really good grounding energy, so that's what I use. So we remove all pain and cure all astral lesions. Just remember, remove all pain. Second one, neutralize toxic emotional trauma. Just remember, remove memories of trauma or pain. Last but not least, send nourishing, unconditional love to all absorbed twins and all astral fragments in the entire family lineage. Because some of the stuff might be compounded coming down, right? And so what we're trying to do here, how do you take all these fancy words and compress it into something easy to remember? Take away their pain. Take away memories of pain. Nourish them with unconditional love. Easy to remember, right? It really is that easy. And so here's where it gets a little bit more interesting, and I had to find this out in a different way. Some of you guys know I do pendulum optometrics. There's a study called optometry, which is kind of like an indigenous culmination of like Brazilian people and a little bit of spiritism, I guess you could say. So optometrics is something, or optometry is what it's called. This is where I kind of got this idea and incorporated it into what I'm doing. So what I'm going to do at this time, and this is really, really important that we do this, is we create a bubble of light around all absorbed twins and astral fragments. Once again, give it a spin, throw a little breath at it, speeds up the process. Then here's the good one. Invert the polarity of the electrons in the astral fragments' astral bodies. This unsticks them. Unsticks them from our energy field. We are a physical body, right? So we have electromagnetic field. So what that tells you is protons and neutrons and stuff, all that stuff's mixing with each other. If we can invert its polarity, we can unstick it from an energetic level, okay? But now that we do that, we're gonna call upon our buddy Hilarion. How many of you guys have ever heard of Master Hilarion? How many of you guys have ever heard of John the Apostle? Okay, same person. When I first got into this fellow right here, I was hanging out with a friend of mine. She's a really interesting gal. She does aura photos. She like speaks with crystals, and she's an animal communicator. She's a very neat gal. Her name's Shay Garrison. If you see this, I love you. Thank you. And she kept showing me these different books, and I kept asking her, "Who's Paul? Who's Paul? I don't know who a Paul is. Do you know who a Paul is?" She's like, "I don't know who you're talking about." And then I finally get home and I start looking at these ascended masters that we were talking about. And I come across this photo right here of Hilarion. And for some reason it stuck with me. And I decided to look him up a little bit more. Find out he's Hilarion the Healer, the Apostle Paul reborn. This is Paul who I was picking up on. So I said, okay, so this is where my introduction with working with a specialty guy for this kind of stuff. Now, I would say maybe you guys have your own that works with you. I don't know. But this is what I found who's willing to work with me, and so I honor the connection, and he's really grateful to help. So what we would do is after we invert the polarity of all the disincarnate's astral body from the physical person, we call upon Hilarion to help us remove this. We ask him for assistance. So I ask, once again, we ask to remove all traces of all absorbed twins and astral fragments in the family lineage. And we merge them back with their core soul or their higher self. Sometimes people can try and put words on this, but all you need to know is whatever part that they come from, this is what we're trying to merge them back to. So you can call it their core soul, you can call it their higher self, call it whatever you want. From here, everybody know that if we're using something, we're using a pendulum to help remove something, what do we have to do after we remove something? Refill it with something beneficial, right? Put something good in it. So what I usually do is I ask to fill all voids with unconditional love, and this would be within the person that I'm working on. And one of the biggest things, after we merge this stuff back with his core soul or higher self, we fill all voids with unconditional love. Express gratitude here. Gratitude is huge here because we're being of service. And when we express gratitude and saying thank you is along the highest vibration that we can ever be a part of. And if everything that we do, we first express gratitude to be able to do this stuff. We express gratitude for the things that come with us, that help us with this work. And then we just express gratitude for having this body that just allows us to be in the mix of all of this stuff and to affect people in a positive way. Think this way, become this way, your vibration will raise and you'll be able to move mountains right in front of people's eyes. And if you get too good at it, you might get people camping in your front yard. So here's a big part. We talked about energetic balance from the outside in. Here's the part that really delivers the results. I had a boy that was in my neighborhood that this is what kind of got me to actually put this together. It was shortly after the last Flagstaff conference we were at. And I was talking to his mom, and this boy was battling leukemia. He had been battling leukemia his whole life, in and out, and he had, he was bald. He always had the different things that would like inject into him when he was at the playground and stuff. So when I talked to his mom, I was just kind of like, I have kind of a different angle on things. Like, are you open to maybe talking about this a little bit in a different way? And so she said, yes. So when you do the dowsing stuff, right? Susan Spiele earlier in her class, Deviceless Dowsing, was talking a little about this being able to see and these kinds of things that I think when we do dowsing with the body and feeling with the body, it helps enhance some of these other attributes: clairaudience, clairvoyance, clairsentience, taste, smell, touch, all that good stuff. So what we do to follow this up, we work from the outside in. And I had asked this lady, I feel that there's a connection with the grandma. I said, this would be like your grandma, technically his great grandma. And I said, I think she was a twin because I'm getting the feeling that this is the woman that's here that has a twin that's attached to this woman. Now, mind you, this a Mexican gal and her mom was in Mexico, and they just had a photo of her, right? They didn't really have a whole bunch of she grew up in the ranchera, which is out in like kind of the country and stuff. And anyways, she had this whole wall full of photos and said, do you recognize any of them on there? And I said, her. Right there in the white, her, right there. That happened to be her grandmother. Through the dowsing system, I found that grandma had a brother that she absorbed, that handed down, and the presence of that dude's skeleton was inside of this boy. And so this is where I'm working on it, where it comes in with water, because this is the big part that really creates. So water imprinting protocols, you can use this stuff. You see in my display over there, I have a bunch of these supernovas up. I found this blue-green frequency to be the best for programming water. Green works really well. Green Grace is actually the first person that I've seen talk about this kind of stuff or whatever, and so I take a little bit of that understanding and mix it with a little bit of what I've found too. But water imprinting, man, there's so many things you can do with this stuff. So blue-green energy gives the best response. The way that we do this, I have my water in front of me. How would I work this water? Well, first, whether it's here, a lot of times the people at a distance will just send me a picture of a glass of water. If they send you a bottle of water with the cap on, have them send it to you like an aerial view looking down into it with the cap off. I've just found, once again, I get the best response that way. But a glass of water, all day, do it just like this. So if I had a picture on my phone or in front of me, I would ask to connect to the consciousness of the water, and you'll see it happens really quick. And now we ask to increase the water's ability to receive healing energy to its highest and healthiest state. Simple words, raise consciousness of this water to its highest and healthiest state. Neutralize all non-beneficial ingredients and sediments in the glass of water. That would hurt whoever's going to drink this, right? Do your breath. Change the energetic color of the water to blue-green to optimize balance and harmony in all water molecules. Okay, so these are like the 3 steps that I use to prep the water, to get it ready for the person to get certain the other commands that are coming. So when there's a presence of some sort of absorbed twin, astral fragment, whatever you want to call it in the body, these are the commands that I place on the water after I just prepped it and got it ready. I made sure there was nothing non-beneficial in it. I raised its consciousness and its ability to receive healing energy. I prepped it. Now I'm ready for the real good commands. First one, neutralize and completely dissolve all cells, tissues, and molecules of all absorbed twins, astral fragments in the physical, emotional, mental, and spiritual bodies of the person we're assisting, and don't worry about this. That's just kind of something that I do. You guys don't have to do that. That just like tells my body muscle memory what I'm about to do, and then I hit it. So that's a me thing. You guys don't have to do that, but if you like it, cool. But not everyone can snap and do the pendulum at the same time, so you don't have to worry about it if you can't do that. Gently and completely flush out all cells, tissues, molecules, and emotional trauma from all absorbed twins, astral fragments in the physical, emotional, mental, and spiritual bodies of so-and-so. So this is, if you're gonna do this work, make sure you tell people about this. As you say, hey, if you're gonna drink this water, make sure you're done for the day. You're not getting ready to go to work. You're not getting ready to go be busy and go hang out with a bunch of people. You're in for the night. And if you're got the next day or two off, that would be optimal, because sometimes people have to use the bathroom a lot after doing this. It's a body's natural way of flushing stuff out of the body. I've had people vomit before. I've had people get really, really hot, get muscle spasms, twitches, all sorts of different pressures that come and go in the body. See this as energy leaving the body. But what's the most common way? Flush it out through the way our body naturally flushes stuff out. From there, last command, harmonize all cell, tissues, and fibers of the body's vital organs and systems, promoting a perfect balanced health in the physical, mental, emotional, and spiritual bodies of the person you're working on. So after we do the flushing and the clearing, we place something beneficial in place of it. And so with that water, we're gonna ask to harmonize all cells and tissues and everything with all systems and all organs of that person's physical body. Once again, gratitude. Gratitude expressing here is going to be good. One of the things I like to do here is balance and align the chakras. Balancing and aligning the chakras after something like this is going to be really helpful for people. You can do the work and they'll probably be fine, but for me, if I'm already going to go this deep and I'm already going to work on them, I'm just going to hit them up with a little balance and align. Anybody ever go get their oil change on their car and then they say, hey, do you want me to go ahead and make sure your tire pressures are all up to par and all that good stuff? Sure, why not? Probably help the car run good, right? So what we want to do is balance and align the chakras. And there's a lot of different beliefs that are out there. You got the 7 major ones, you got the ones below you, you got the ones above you, but there's 3 areas that I work with the most. And that would be the Earth Star chakra, which is the one that's underneath us, and the importance of that is it helps ground us. It helps ground our energy to this. The heart line consists of the Earth Star chakra, but also a few other ones that go up, including the thymus. And this heart line, some people would say that these chakras specifically create your astral body. The assemblage beam is usually up in the chest. This is where our energy and our physical body are aligned. Sometimes trauma and stuff can kind of like misalign us and stuff and give us like little feelings of like vertigo and just sometimes circulation issues and stuff. But the last one would be the galactic cord, and all that is just your higher chakras connecting you to your spiritual stuff. So you guys can dive into all of that in which way suits best. What I have pictured is my prayer pendulum, white light. White light frequency pendulums are good. A lot of people like Isis pendulums, fantastic. Isis pendulums are real good for this kind of stuff. White light energy seems to be the one that I get the most response with balancing and aligning chakras. Once again, don't listen to me. Try it for yourself and see what you get. So how does that work? Balance, clear, heal, align, and strengthen the connection and function of, you can do this individually or all at the same time. Earth Star chakra, heart line, assemblage beam, galactic cord, and all sub-level chakras. So I always put that there because I know that there's chakras that are associated with the subconscious, and I don't really have a ton of information to say this is this and this is that, but I know that it's a presence, so I talk about that. And we just ask to balance them back to their highest and healthiest state. Fill all voids with the white light of Christ or source energy, unconditional love, whatever you want to call it, and allow complete and total balance to take place in all areas of the physical, spiritual, mental, and energy bodies of the person you're working on. So anytime I do spiritual clearings where someone has a haunting, I always follow it up with the white light pendulum and I put a blessing on the place because it helps hold it. How many of you guys have ever heard of people burning sage to help clear the place and they follow it up with sweetgrass or cedar? Right? Help hold it, right? It helps hold that. You know what I mean? Same kind of concept. Gratitude, man. Gratitude is key here. If we're grateful for the opportunity to do this work, we operate at a very high level. And so because of that, we can do some really cool things with the elevated vibration. Being given the opportunity to help and to thank the beings of light that assist us in this work every day, at the end of the day, we're just vessels. I'm not doing the work here, but I'm allowing everything that I am to help process it. How many of you are familiar with Reiki? Okay, is it your energy that we're giving to people? No, but we're a conduit and we're letting that flow through us, right? It's the exact same concept. When I talk about the breath, people think that that's your energy. Man, I'm sending life force. Whatever flows through me, flows through those rocks, flows through those trees, flows through those clouds. That's what I'm sending to you. That's not my energy that's going to that, okay? Some other resources, you guys can check me out, pendulumopmetrics.com. I got some fancy pendulums to help with my work and the stuff that I do. You're more than welcome to email me, nicksalzman@gmail.com. 2 S's. That first one's my middle name, so Nick S. Salzman. I have a Facebook, Instagram, YouTube, and TikTok under Tattoo Medium. So some of the stuff that I do now, the reason why it's Tattoo Medium is because, for one, I'm a tattoo artist. And what I get to do now is when people get in my space, we get to have some fun. And a lot of times I get a chance to help people with different clearings. Basically, if you make it in my chair, you probably got something going on at home that's going to bump in the night. And if you come in and talk to me for a little bit, we'll find it, bring it to the source, and then there's usually people who are going through other things where maybe they're like nervous or they're depressed or they're sad or they're going through all this stuff, which is directly related to what's around them all the time. We learn to acknowledge what's there, why it's there, clear it, and send them out of there feeling a lot lighter. I guarantee you the tattoo wasn't even the reason why they're there, but we lure them in. Sure, it's about the tattoo. Come on in, because usually when they leave, it had nothing to do with the tattoo. So, just want to say thank you to everyone for being a part of this presentation. And I'd like to thank Susan Spuler and the rest of the staff from the Flagstaff Dowsers Conference for having me present my passions to the world. And yeah, I know I got a little bit of time still. I got about, 13 minutes. So good, 10 minutes, perfect. Because I really wanted to make sure I was getting through this quick so I can answer your guys' questions. So, questions?
Are you putting this in a book?
You know, I probably will. I probably will. This is what, but I already have like another book that I need to write too, and I've already wrote 3, so I'll probably get there. But yeah, this is absolutely going into a book because I think it's really important for people to jump off of and see, because this stuff is really connected to a lot of other diseases like hyperborsolia. You ever seen people that get like what they call butterfly skin, or like the rashes, or like their skin breaks open like really easy and stuff, babies get it and stuff? This is 100% connected to it too. Basically, every time I found a new disease, I found a connection with this stuff, and I had to move forward because it was sending me down more and more and more rabbit holes. So not only is there a part 1, probably going to be a part 2, I imagine, down the line.
Our body has more than 70%, I'm not sure how much, but over 70% of water.
Mm-hmm.
Why do you need to use a cup of water, bottle of water? When you clear the person, why don't you use the water within the body?
That's actually a good question. But you know, I haven't really tried utilizing the water in the body, so I welcome you to try that. But I do know that if I can say, if my body has nutrients already and I want to work with those nutrients, it's good. But if I introduce more nutrients into the body, it gives more fuel to work with. You know what I mean? And really what we're doing is spontaneously causing change here. I'm trying to cause something on a cellular level. So I haven't exactly worked with the water in someone else's body, but I know that they're water and I'm water and that's water, and so we're connected. So that's why I kind of use that, because sometimes this water really helps people flush their system really, really well. When sometimes they need a little jump start, right? It's kind of like bathroom. We go to the bathroom really easy, but for some reason, why would we need coffee in the morning to make us go to the bathroom? But for some reason, it jump starts that. You know what I mean? So, same kind of concept, but I like that question. It's definitely something I think I'll look into.
Nick, would you say that this is a neutral place? That having that separate glass of water is sort of a neutral place for you to work?
You know, I would say yes, and what I'm hearing right now that I'm going to talk about is I think when they send me that picture of a glass of water, it tells me they're open. They're open and they're willing to accept. And that, I think, symbolically is very much there. Now, a lot of times people like want to see what you can pick up on just to see what you can pick up on. They don't actually want to do any work. They just kind of just want to see if you can figure out their deepest, darkest secrets and know them right away. And I always tell people, yeah, but only if we have the same one. Because at the end of the day, what's in me is also within you. And if I can tell what's wrong with me and the reason why you're here in my life, I know you perfectly.
Nick, can you talk a little bit more about the tattoo medium that really?
I mean, I could waste the next 20 minutes talking about it. Do you have a question about it?
Well, I was in the army.
Okay.
We were drunk and crazy.
Okay.
And I remember I got a tattoo. Right?
Mm-hmm.
We were drunk, I ran everything. I said, I can do that even with a pen, and he broke a pen, the ink and start with a needle.
Plenty good stories start this way.
I know, accidents that fix. But years later, we were doing something in a farm or something like that, and somebody come told me there is something in your tattoo. There's something in your tattoo that needs to be removed.
You know,
And I never put too much into it until you just.
You know, I would say that there is intention behind tattoos. Intention absolutely goes into tattoos. Some of the things that I found, it's the same thing if you want to go down this route, it's the same thing of eating food from someone that's cooked that has issues. Like say, for instance, you have someone, you go to this place or whatever, you go to a restaurant and the person that's back there cooking their food is having a real hard time in life. They're really angry because they're there. They hate their job. They do this and that. It would be normal to eat that food and then later feel irritated for no reason. So I would say there is intention with it, but I wouldn't say like you got a spirit in your tattoo. I would say you are spirited for getting that tattoo, but I wouldn't say that you actually have like an attachment rather than some sort of an emotional connection with that person.
Funny you mentioned that because I had that problem. And my wife always says to me that I have to be careful with what I eat. If I don't clean energetically the food, that very same night I'm gonna drink whatever cook the food. I'm gonna see what the people do. And it's no fun so many times.
So one of the things you guys just saw, the way it works right now, being someone that does these readings and stuff, is I come up with stories and it makes it sound like, and then go, oh, it's funny you mentioned that. And there's a reason why I bring that up, and it's not because I know, because it's something that I know that you're going to connect with. And so at the end of the day, if it starts coming out of my mouth before I can even think about it, I'm just going to let it flow. And so for whatever reason, the cooking has a lot to do with it, because I think that was something that would be comprehensible to understand, if that makes sense. So the whole tattoo medium part, dude, I mean, like for me, like a lot of people want to connect with like loved ones, and sometimes that comes up. Sometimes deceased ones that come away, especially when I do like memorial tattoos for people, those are always a real fun session because people can get a lot of healing from that stuff. But more times than not, there's things that sometimes people don't want to deal with. And sometimes I don't even want to tell them about because I know that it's probably going to shatter the reality, which of course you got to use discernment. I like using the sway technique, some of that deviceless dowsing, to figure out whether or not I should say something, or is this someone from their side of the family, or is this a non-human spirit? Did this happen in the bedroom? You know, like I'll go through all these different reads with these people, decide if I even want to talk about it. But most of the time people come in with something that's giving them issues at home, and then I see it in my mind, I connect with it, I pull them forward, and then I clear them after they leave. And then they walk out feeling lighter. So mediumship is just kind of the word of it, but really I'm just the middle ground. I'm the middle ground between the physical and the spiritual, and I'm happy to be of service. Yeah, thanks for asking.
Have you known like the psychotic or the schizophrenic people to get better after these treatments?
This is really hard. That's a very good question. These are the hardest cases because they usually have some sort of self-sabotaging behavior that knocks anybody else's ability to work. They say, this is the way things are. I know it's like this. This is what I need you to do and nothing else. None of it's going to work.
My friend's ex-husband knows he has this vanishing twin, and he's caught in that loop about always talking about it, and it's like, there should be an exit somewhere.
Well, you know, I would say for someone that's like surviving and knows about this stuff, right? I definitely think I've heard some people talk about there was actually someone here, I'm trying to remember who was telling me about it, but actually would call forth a conversation with this twin that was absorbed. But what I just help people understand if you're like schizophrenic and dealing with this stuff is because I believe you have something that you're connected to that is now in the spiritual realm, and believe me, when you two work together, you're going to do some really cool things. But schizophrenic people also deal with a lot of trauma that's unprocessed and it's out of an unhealthy way. There's someone really close to me in my life that good person, ended up having a husband that overdosed. He had a lot of issues, a lot of spiritual issues, and he overdosed. Well, she got in a fight with him that night before it happened, and so she took that on herself, which of course this guy had issues long before they were even together, right? But she chose to turn to God. She chose Christianity and turned to God and just tried to really develop that cultivation, and she is absolutely a paranoid schizophrenic now. Reason being, why are you going to God for such a connection? Out of fear, not out of love, because she wants to be that love and that connection. She is trying to render herself, if I memorize the Bible and I walk a certain way and I pray and I fast and I do all this other stuff and stay away from spiritual attacks and all this stuff, right? This is where they stay. The intention is everything. She's asking to connect to God for protection from the things that she's did because she can't forgive herself. rather than loving God for the presence in their life. Big difference. But she could be a medium if she chose to.
Chemical sensitivities. You run into that much?
Yep, allergies. Allergies, big time allergies, a lot of stuff. Chemical, even like sunlight stuff, but usually allergies to like different foods like shellfish or cats or grass and this kind of stuff or whatever. There seems to be a lot of allergies associated with this because it's all connected with that autoimmune stuff, you know what I mean? So I would say if you know someone that has a lot of allergies, take a look at this. See what you find. Don't take my word for it. See what you find is what I found.
Do you clear them in like one session?
Usually, but what I found is when I get 3, I get a follow-up. So I'll do the big major clearing. I'll do the big one that I do with the pendulum, and then I follow it up with the water. And then usually, like, if I can get them to do the water like 2 or 3 more times, usually like 2 more times over the span of like a month and a half, I really get good results from that. But the ones that are open to the energy work and not the water worked on probably about 60-70% of the cases. Any questions? Yes.
What happened to two twins born, have a life together, twins hardly, they rarely separate from each other, and one dies? How do we help the surviving twin?
Well, that's actually really good.
She's actually trying to retrace her twins, like the room she stayed in, and she came to this conference. She's trying to walk and become her in a way where she feels that if she becomes her in some way that she's not gone. It's really
What I'm hearing
difficult to watch.
is guilt. Guilt's gonna make that manifest. Guilt, big time. So once again, what's the motive? Are we honoring her, or are we doing it because we feel really, really bad? When all we have to do is thank her because she's now that other half of us is in the spiritual world and can be really, really helpful to us, right? And just like the whole approach of someone coming down and dying now, I'm assuming this twin died after birth, right? They lived and then they end up passing away. We see this happen all the time. How many times have you guys seen in like a family where like just before a kid's born, someone dies in the family? Right? I feel that there's like a cycle here. I feel that our families can support a certain amount of people, and for whatever reason, they choose to come down and die of an unknown way, or maybe it was a traumatic death, who knows. But for some reason, they are now on the other side, right? And so what I would say to that person, if I was talking to him right now, is the best way to honor them is to live your life to the fullest. Develop yourself spiritually, develop your vessel in the best way, so that way you can give that to the world. Don't live in a shadow of that, which is, I think that's why you like that saying, are you living in their body or are they in yours, right? Because I think we take on these components and stuff. And so if I was her and I was dealing with this, I would probably even go back to the room in a meditation and then just express my love, gratitude, and appreciation for their continual presence in my life.
And to express their individuality.
Sure.
Yeah.
Absolutely.
In cases like hers, I feel that when the significant, the other person has not crossed over completely, there's a deep connection. That's why the struggle with the person who's still alive.
You're right.
I don't know if you do that, Nick, or not, but you help the other person who passed to cross over completely, and then that disconnection will be complete.
Well,
The person can live fully.
one thing's for sure, I mean, I think the connection you're talking about here, for one, it's all mental. This is going to be something that energetically you guys are always going to be connected, no different than you connected to the environment, right? And so helping them cross over, you bet this is huge, especially if they died of sickness or if they died of like a traumatic death or something where they're in like an agonizing state, which unfortunately doing this work, this is the basis of what I do, is crossing over earthbound spirits. When people say they die and are in a better place, ignorance is bliss. Because they really are around a lot, and a lot of them are still having a hard time, especially seeing you have a hard time in life because they're gone. They stick around and they watch that stuff. So when we help heal them and cross them over, they now have the opportunity to come back and assist us whenever they want to, and they're so much more whole at this point. And so what we have is the opportunity to have someone from our family, someone close to us, that is actively on the other side, looking out for us. But if we do not heal them and help them cross over, then they're going to be protecting you with the strength of a 5-year-old child. We heal them, help them cross over. They'll come back whole, and usually with about a dozen other people in your family that will very much be able to protect your house and be able to come into your dreams a little bit more and just have a greater area of influence in your life in a positive way.
Yeah, I did do that. I thought about that. And I think it's just that one breathed in, the other breathed out. They finished each other's sentences. They brought close for each other. They did individual breathing together. And all of us who knew them together, we felt so sad that this twin it makes me want to cry for her. Left behind.
There's a deep attachment,
So deep.
yeah, that attachment needs to be healed for both to be able to go
For
on.
her to
their
go
separate
on with
ways.
her.
They're always connected, but yeah, that attachment needs to be healed for sure.
Yeah, that's a real thing. You share connection with someone that, that's like the closest thing you're probably going to have to a soulmate, someone that understands you perfectly, knows your likes and dislikes without being married to that person. You're very much connected to that person. But understand with that connection, the better we treat ourselves, the more we honor them. And that's the reality of it. Spiritual alchemy is going to help that. And I'll throw one last little unpopular opinion out there. If you guys are looking to start crossing souls over people and start sending them to the other side, here's an unpopular opinion. I have a whole video on this. After you do the healing, take away their pain, take away the memories of pain, nourish them with unconditional love. Ask them, can you do me a favor? Can you look down the middle of your chest and tell me, do you see a light? This can change everything. Looking down to seeing that light, that's our soul. That's what merges us to the Creator. We say, okay, look at this light, gaze into this light, take a deep breath in with me. Ready, 1, 2, 3. Use the breath to clear them on the spot. If we call, which is what I used to do, call upon a family guide or someone, spirit guide or someone like that can help send them to the light, a light source outside of us, that tunnel that's always talked about, this is a trap. This will get you thrown right back into reincarnation. There is no rest. You'll get put right back into a physical body, and that's the way it is. If you get merged with Source, back to the Creator, you can study and travel for 1,000 years. You can do whatever you want. Decide to come back at this very moment. So from our perspective, it's like they never even left. So this is where you have people that are like, oh, I don't want to cross over grandma. We love her. And well, grandma died of a brain tumor. She's not doing too good. Help her out, and she'll be able to come back at this very second like she never left at all. But her state of being is be very different because spirits reside outside of time and space. That stuff don't matter to them. But it's, 30 years to us could be like a week for them. So it's kind of a mind-opening thing, but I would recommend trying that if you guys get into this work. If it's a person, they have a light source. If it's a non-human spirit, they don't have this. And they don't go to the light, not because they're evil and they're bad and they're not part of the light and all this weird stuff, right? No, it's because they're smart and they know that that's a freaking trap and they don't want to get thrown back in here. They want to exit the system. So this is why we call upon some sort of spirit guide or guardian angel that can take them to the place they need to go. We just need to look at this stuff with a lot more love and compassion and not let fear be our guide. That's really what it comes down to. Yes?
I wanted to talk, so would you mind going through those few things? Take away the pain was the first one, and then what was
Take away the pain,
yeah, to help
take away memories of pain.
memories of pain.
And you could do this from all timelines, future, past, present, and parallel. You can also come up later and I'll tell you, and I have a few other videos on YouTube that break down that specifically. So, I mean, this is just kind of what we're talking about, but I have tons of videos on YouTube that has all this for free, that you're welcome to use it. And so the last part to it would be to nourish them. Nourish them, whether in their soul, Christ spark, whatever you want to call it, just nourish them with unconditional love. Allow them to feel full, content, and complete once again. And once we get that there, you should see how much they remember stuff. People always want to talk to ghosts. When were you born? Where'd you come from? Da, 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 da. And they're operating in like a limited state. Take away their pain, take away their memories of pain, nourish them. All of a sudden they perk up and they can answer your questions a hell of a lot better.
So type 1 diabetes is considered an autoimmune. How much have you dealt with type 1 diabetes in children?
You know, I would say diabetes in general I've came across, and it is a type of autoimmune, so I would absolutely look at this angle and see what I could find there. Absolutely. Sometimes it's a diet thing too, that we can get diabetes from like a diet or whatever, but I know that if we have issues with like gaining weight or our thyroid or our metabolism and some of the stuff that's like connected to it, and it's a small child already experiencing this, absolutely take a look, because they're the easiest ones to help. And full-grown adults are a little bit harder, but the best way to do all of this would be to balance the mother. Balance the mother while she's pregnant, before she's pregnant. Because if you guys don't get this, the whole thing that we're doing here, right? You guys hear about we're in this age of Aquarius and the rising divine feminine, right? We're hearing this that people talk about. But what if what we're doing now is trying to balance our mothers, try and balance their physical bodies, try and balance their energy, so that way they can become these perfect vessels to bring more life into this planet, so that way the divine masculine can reinforce that and lift her back up to where she's supposed to be. We are here to help our women. Absolutely, 100%. That's what this stuff is for. So I don't like surface level stuff. I like getting deep, and I like talking about stuff that nobody knows nothing about, because it makes me easily sound like an expert. So thank you so much, you guys, for being here, and I'll be doing it again tomorrow if you guys want to come again at 10:45.